So when a patient presents with breast implant illness, their options for surgery are as follows. Number one, have my breast implant removed only and do nothing. Number two, have my breast implant and the capsule around it completely removed, what's known as a total capsulectomy. And sometimes people use the terminology of en-bloc capsulectomy with implant removal. Again, the International Society of Aesthetic Plastic Surgeons recommends to plastic surgeons not to use the terminology of en-bloc because that's really referring to cancer surgery. And number three option is to remove your implant with a total capsulectomy and performing a breast lift. Most patients require breast implant removal and a breast lift. Another recommendation by the International Society of Aesthetic Plastic Surgeons was to tell plastic surgeons not to call themselves breast implant removal experts or breast implant illness experts, because truly every board certified plastic surgeon can remove implants. Removing implants is not very difficult. Essentially, you go through the same incision that was created for implant placement, and then you extend that incision to the implant capsule, and then you remove the implant and you put a drain. If you decide with the patient that a total capsulectomy with implant removal is necessary, then once you reach the capsule of the implant, instead of opening the capsule and removing the implant, then you perform a capsulectomy around the whole of the implant. That means the surface that is under the breast and the surface that is over your rib cage, and you remove that entirely together. Sometimes to do that, you have to make bigger incisions because you have to remove a big implant with a capsule through the same incision. But then what? Then you are left with a breast that is deflated, with sagging tissue, with excess skin. The choice of your breast lift will ultimately determine your final outcome.